fight against the pandemic now since June 8th. At least 1.6 million people have been reinfected with COVID across 24 states. The Omicron subvariant, BA.5, now the most dominant strain across the nation, is making up more than 65% of all COVID cases. And now the San Diego Unified School District, one of the largest in the nation, has reinstated an indoor mask mandate as COVID-19 cases are on the rise there. Chief Innovation Officer at Boston Children's Hospital, epidemiologist, also ABC News medical contributor, Dr. John Brownstein joining us for more. Oh, boy. Okay. Yeah. Well, being a San Diego native, this is impacting a lot of friends, families, you name it. I also got hit hard with this variant. It is no picnic, John. And now you've got Anthony Fauci saying that he and the COVID-19 panel are very seriously considering additional booster shots for those under 50 amid all these rising cases. So what do you think? Is that the answer right now? Is that a good idea?
Well, good morning, Kira. It absolutely makes sense that we should be thinking about broadening recommendations for the vaccines and potentially targeting masking. I'm also someone who got hit pretty hard with maybe the BA.5 or BA.2. Either way, recognizing the fact that vaccines work incredibly well to combat severe illness and death. And that second booster is really compelling. So it makes sense that that recommendation might expand to younger adults who want them. But clearly, we don't want to undermine the booster campaign that might happen in the fall. And we'll have a new improved vaccine, make sure that people that want those vaccines in the fall can get them. But for now, we need to do what it takes to keep transmission down in the community. That's through vaccination, testing, and unfortunately masking in some areas.
So the CDC panel is meeting today to discuss the FDA-authorized Novavax vaccine. We actually interviewed the CEO of Novavax this past week. This would be the fourth authorized vaccine and different from Pfizer and Moderna because of its protein base. Let's explain why this has been making news and the difference here, John.
Well, the reason is that Novavax is a much more traditional vaccine because it's based on a protein, and it's very similar to other vaccines that we're used to, like the flu vaccine. And so there was a compelling argument that people who were maybe concerned about an mRNA vaccine would potentially take this vaccine. The problem is it's quite late in the game, and now we have Omicron, and this Novavax vaccine was targeted to previous variants, and now we're going to have these new and improved boosters in the fall. So it's very unclear where this vaccine will come into play. There's clearly some people waiting, but for the most people, I think it's going to be a lot to consider them to take this vaccine. I think hopefully we'll see more people taking this booster in the fall when we're targeting against Omicron. But of course, it's nice to have a fourth option right now.
Yeah, definitely. Okay, you're in New York, where 521 cases of monkeypox have now been identified. The governor there said that she'll be receiving more than 32,000 additional doses of the monkeypox vaccine. So will this prevent the outbreak from growing, you think?
Well, we have to remember not to repeat the mistakes of the past with COVID. With vaccines, we vaccinated, of course, late in the game. That's because we didn't have vaccines. For monkeypox, we had an effective vaccine, and we're immunizing people late. You don't want a vaccine in a surge. You want to get people immunized ahead of a surge. So that's problematic. And in New York City, there's over 30% of the cases, but only 14% of the supply. So we need to do more to vaccinate and make the vaccine available. There's a massive amount of demand, but we also have to increase testing. We have to increase education. This is a virus that we could have controlled, and yet again, public health has been slow to the game. So hopefully these new measures will make a dent in preventing additional cases in the community.
All right, Dr. John Brownstein, great to see you today. Thanks, John.
Thanks, Kira.